Set 2 exercises. These exercises are designed to be more challenging. If you're progressing well and find the exercises in set 1 easy, you can move on to the exercises here before you return to the hospital for your follow-up appointment. People's symptoms vary enormously before and after this operation. We do not expect everyone to be able to complete this second exercise set in the early few weeks following surgery. It is no failure on your part if you remain on the set 1 exercises that you started with. Remember that you cannot damage the surgery. Increased pain is not an indication that you're damaging the shoulder. Choose the exercises that are difficult, feel weak, tiring or stiff, rather than just painful to do. Increased pain at night and when resting may indicate that you're doing too much. Continue to use pain medication if necessary. No special equipment or gym is needed. Your individual requirements will be discussed at your follow-up clinic appointment. Further exercises and treatment will be given depending on the demands of your shoulder and your progress following surgery. The exercises are broadly divided into those that emphasise movement, set 2A, and those that are more for strength, set 2B. These exercises can be done once a day. Generally, we would recommend doing set 2A first, but feel free to experiment. There is no right or wrong exercise. Explore what feels useful for you. If your muscles feel sore and stiff from overload work, i.e. doing something unfamiliar, then give them a rest day before exercising again, and this muscle discomfort will reduce with practice. Set 2A. Forward movement. Stand with your opposite leg to your operated arm forwards, as if you're taking a step. With your elbow bent, lift your hand up towards the ceiling, straightening your elbow as your arm raises. Alternate arms if you're able to, and imagine the arm is floating upwards. You may feel a stretching in your shoulder, arm, or even the side of your body. Aim to repeat 10 times. If it is comfortable and you wish, you can repeat this twice more. Out to the side. Bend your elbows and rotate your hands outwards. Lift your arms up as if you're aiming to clap your hands overhead. Start with the elbows staying bent throughout, but over time try and complete the movement with the arms straight. Your hands may clap in front of your face initially, but will gradually be able to meet higher, aiming for overhead. Hand behind your head. Lift your arms up, aiming to get your hands behind your head. Initially, you may only reach your face or the top of your head. Try to keep your head up, looking straight in front of you. Once your hands are behind your head, a further stretch can be given by pulling your elbows backwards. Repeat 5 to 10 times. Hand behind you. Standing with your arms by your side, move your arm straight backwards. You can help the operated arm by using a pole, such as an umbrella or broom handle, as demonstrated here. You may increase the stretch by narrowing your grip on the pole. Repeat 5 to 10 times. Hands behind your back. This is a progression from moving your hands behind you. Take your hands behind you, but then begin to slide your hands upwards towards your back and shoulder blades. This can be a pain-provoking movement, so do not force the arm unduly. Using the assistance of the pole can help. Repeat 5 to 10 times. Cross body stretch. Lift your arm up in front of you at shoulder height. Guide your arm across your body, keeping the shoulder blades still. Apply some gentle pressure at the elbow to maintain a stretch. The stretch should be felt in your shoulder or arm. Sustain the stretch for 20 to 30 seconds. Repeat 3 times. Overhead stretch in kneeling. Start on your hands and knees, hands under your shoulders and knees under the hips. Sit back towards your heels, keeping your hands still until you feel a stretch. Keep your body straight and move your knees further back if you cannot feel some tightness at the end of the movement. To give an extra stretch, you can turn your head to look under the opposite armpit. Sustain the stretch for 20 to 30 seconds and repeat 3 times.